will reach out to you with material and our answers. So yeah, let's get started. Let me introduce CareXO first. CareXO is a boutique consulting company. It specializes in transaction advisory and strategy projects. It is focused on policy shaping, national strategic initiatives, public-private partnership, and the mandate for CareXO is to enable and empower representative health innovation in the Middle East. Innovisor is a healthcare native company. Its technology offers many unique capabilities honed and automated over several years that enable Innovisor to deliver exceptional results at an accelerated pace for its customers. Innovisor is currently building solutions and solving problems for almost 70 plus customers at 1600 plus care settings. They are custodian of 50 million plus patient data. Innovisor has delivered tangible value across key levers and work with a robust partner ecosystem. Today, we will have this 60-minute session dedicated to finding conclusive answers to these questions. And we'll try to chart out the roadmap for healthcare AI adoption and related outcomes in the Middle East. So yeah, let me hand it over to Akhtar for a quick introduction. Akhtar, over to you.
Hey, good morning, good afternoon, everyone, depending on the time zone where you are. My name is Akhtar Mubaraki, and I'm the General Manager for Innovisor at Middle East, primarily focusing on building the healthcare landscape in Middle East. Before Middle East, I used to lead the customer success and ROI for Innovisor in US for last 10 years, helping large-scale organization to implement population health management and patient experience solution and derive value out of it.
Thanks, Akhtar. Dr. Waleed, do you want to go next?
And good morning and good afternoon, everyone. Happy to be here with you guys. My name is Dr. Waleed Zahar. I'm the founder and Chief Executive Officer of CareXO. I'm a physician by background, but I've spent the last 15 years doing research in the Middle East, primarily in Saudi and in United Arab Emirates. I'm happy to join this fruitful discussion and looking forward to the outcomes of our webinar. Thank you.
Thanks, Dr. Waleed. Nila, over to you.
Hi, everyone. My name is Neela. I'm a Senior Director of Product at Innovisor. And at Innovisor, I focus on two things, the experience of patients and also AI productivity and how that can transform experiences as well as bring more efficiency. So that's my focus area here. And I'm very excited to join this conversation.
Thank you, Nila. Hi, everyone. This is Pankaj. I'm going to moderate this session today, and I head growth and strategy for Innovisor. I'm really looking forward to this conversation because we all have been having these conversations around the role of generative AI in patient experience. So yeah, let me get started. We want to start with understanding what patient experience mean in today's world, right? And we keep hearing that the landscape of expectation continues to change when it comes to patient experience, especially with the advent of new technologies, processes, and policies. So let me start with Akhtar. What does the patient experience mean in today's world?
Thanks, Pankaj. When we talk about patient experience, it's a very subjective terminology, and it's not a single factor that contributes towards patient experience. It's a combination of large number of factors that jointly define what patient experience is. If I have to focus on the top main aspects, what will define patient experience, I would love to start with accessibility. Is care accessible to everyone? Because even if I talk about US and Europe, who have been kind of focusing on patient experience for last 10, 15 years, the biggest barrier that we see in terms of patients getting care is accessibility. Hey, do they have the right clinics available? What's the geographical proximity of the care? What's the health equity? Are there any social or cultural or transport barriers? So making sure that the right network is available for the patients in their proximity where they can kind of easily go if and when required, that becomes a very critical factor for patient experience. The second biggest factor I would talk about is affordability. Is care affordable? Is it coming at a price that patients can actually afford? And is it accessible and affordable for everyone? When we talk about affordability of the care, we have to consider other factors as well. That, hey, if it's available at an affordable price, is it efficient and is it effective? Because we can have care available for everybody, but is that actually helping patients to get the right outcome? So effectiveness of the care becomes very important. And when we think it from the patient perspective, in terms of affordability, the other factor that we have to consider is the safety of the patient. Care is accessible to us, it's affordable to us, it's effective, but are we following all the guardrails in terms of patient safety? Are we enabling those guardrails and making sure that patients are in a safe environment, both from the experience standpoint as well as from their data standpoint? So those two for me are the most important factors, are the primary governing points for patient experience. It should be accessible, it should be affordable, with the right guardrails around it.
Thanks, Akhtar. Makes a lot of sense. Can I access the healthcare? And when I can access it, can I afford it? And Dr. Waleed, I think I would want to hear from your experience, what are the key components of patient experience are?
Again, that's a very good question. And as Akhtar has said, the definition of the patient is a bit subjective. But affordability and accessibility are one of the pillars of how we define it, irrespective of whom is talking about patient experience. That being said, I think we also can add that other factors. Among them is the quality of the care that is being provided and how much the patient is involved in that journey of patient experience. Patient education and engagement are being added now as a main component of how we deliver and how we deliver healthcare to patients, and it's a part of the experience that patients go through when we are talking about such topics. Clinical outcomes are complex usually when you're talking about patient experience, and some of them are subjective to the physician or to the patient, but nevertheless, the optimal clinical outcomes. How are we delivering effective therapies to these patients? How are we delivering these therapies? And are we addressing health conditions? And we are having the optimal outcomes with minimal side effects. These are all pillars of how we define patient experience as well. And another important subject is also, are we adding or improving the quality of life when it comes to the patient experience? Because not necessarily that all therapies or modalities of treatment are centered around that pillar, the quality of life. And it's becoming now a very important part of the patient journey. It's becoming a part of how we define not only patient experience, but how are we delivering a value-based healthcare through our healthcare system in the region. I would say that the region is very advanced when it comes to implementing such conditions. But again, accessibility, affordability, improving the quality of life, and having optimal clinical outcomes would all define this patient experience, in my opinion.
Thank you so much, Dr. Waleed. We are hearing patient experience means having access to healthcare. Healthcare should be affordable. There should be component of education and engagement. All of this coming together to deliver optimal outcomes and resulting in a better quality of life. And this brings me to my second question, which is, I want to understand what are the top 3 initiatives, or what are the top 3 stories that you guys have seen last year around patient experience? And let me start, Akhtar, with you.
Sure. Thanks, Pankaj. I will say I have the luxury of seeing patient experience both in US and in my short tenure in the Middle East as well. And in this conversation, considering our audience is mostly from the Middle East, so I would like to focus on that. I think Middle East is in the very right direction. The broader goal that more or less every country in GCC is kind of following, that, hey, we have a vision 2030 and we want to kind of make healthcare accessible and we want to kind of have a better model for healthcare. I think that very much aligns with patient experience overall and improving patient experience. If I talk about a couple of at least the programs that I have noted over here, those are very gonna be like gonna put patient experience on a very good roadmap. Specifically, if I talk about in the Kingdom of Saudi Arabia, the patient experience measurement program with the Ministry of Health has initiated to quantify the experience of the patient. It's a very amazing initiative that not only helps us to understand how patient experience is, but at the same point of time, it helps to take corrective actions in terms of how can we make patient experience better. They have devised surveys for patients, they have devised surveys for the caregivers and the other members associated with the patients to understand that, hey, what are the key areas of the improvement that we should enable in order to make patient experience better. I think that's an amazing initiative from the kingdom. Similarly, if I talk about the health integrated system network that the government of Qatar is launching with a broader focus of improving the life expectancy of the patients, it plays a very important role in terms of in terms of improving patient experience, my apologies, because they're focusing on the very first element that, hey, healthcare has to be made accessible for everybody and it should be affordable for everybody, which directly ties to the first 2 points when I was talking about that, hey, what are the key elements of the patient experience. So considering that, I think Middle East is in a very good roadmap and a very good strategy in terms of how they are visualizing patient experience and how they want to enable it in the long term and the short term roadmap.
Thanks, Akhtar. Very encouraging to see that now patient experience is being discussed at the highest levels across GCC. And Dr. Walid, we want to listen from you, since you have seen patient experience being discussed and delivered both at a regulator and an operator level. What is the UAE perspective here?
Thank you very much. And yes, I think Akhtar has nailed it, and he has given a very good example when it comes to two GCC countries, Saudi and Qatar. I'm here in the UAE, so I'm gonna deliver what is happening here, but maybe I'll assume the role of the regulator. So there are the UAE is a federal based on a federal system, and we have not one but 3 initiatives that all feed into the patient improvement of the patient experience. When it comes to the Emirate of Abu Dhabi, the Department of Health, which is a regulator there, have issued in the past decade a program called Jawda, which translates into quality or excellence in healthcare. And then that was further integrated in a new initiative called Muashir, or the signal. The aim of this program is to assess the patient experience and the optimal clinical outcomes when it comes to the Emirate of Abu Dhabi. And in Dubai, the same initiative was launched under the name Ijada, which means excellence in healthcare, which assesses the same metrics. And on a federal level, when it comes and the Ministry of Health have issued a program called Riayati or My Care,
which is not only fed by the data coming from the hospitals under the Ministry of Health, but it's also fed by the Unified Health Exchange platform of Abu Dhabi, which is Malafi. So, as Akhtar said, in some countries, the Unified Health Exchange system provides an infrastructure to having a unified patient experience. And I think this is what the ministry is trying to aim, to unify the patient experience in between the different emirates and the different regulators. The outcomes of such initiatives have been great. It's a very transparent index where every year they do announce the results of which healthcare facilities and what is the outcomes of the patient experience in the Emirates and how to improve it. Such initiatives in the region, not only in UAE, but in the GCC region, as Dr. Akhtar said, it puts this region as a mature region when it comes to patient experience worldwide. And it puts it at the forefront in initiatives that further increase the patient experience journey by adding more out metrics and more platforms that integrates in the health exchange, the Unified Health Exchange systems that we have here. And all of that leads to a patient clinical outcome and a more optimized patient clinical outcomes and more fruitful patient experience and more of the outcomes that we want to implement when it comes to the journey of a patient going to a healthcare facility or receiving treatment.
Thank you so much, Dr. Waleed. And again, as I was saying, it makes so much sense. It's so relatable from a patient point of view. And would now want to bring in Neela. Neela, you have this unjust luxury of discussing, seeing, and even shaping patient experience in India, Middle East, and the US. What are your top 3 initiatives or stories that you would want to sort of share with us today?
Yeah, I think Pankaj, you and Dr. Waleed have covered so many aspects of it, but I thought maybe it would be helpful to think about what it looks like from a patient's perspective, and then what can we do not only for the patient, the interfaces that the patient has directly with the health system, but also for the stakeholders that talk to them. How can we enable and empower both these things to make sure that the experience is optimal, right? I would say there's 2 major parts to patient experience, right? One, as you alluded to, is purely accessibility and convenience. That is such a big part of it, right? If I'm a patient, the top of mind thing for me is I'm not feeling well. I need to be seen. I need to be seen very quickly. And it shouldn't be onerous for me. I shouldn't have to go somewhere and wait there for 1 hour before somebody will look at me, right? And I would say that the expectations of patients around how quickly and how well you can access care is also shaped by other industries they interact with, right? Like retail and banking. I mean, everything is at people's fingertips today. So it feels like a big stark difference if for just healthcare, which is so critical to your life, you have to have such long wait times and so on. So everything that we can do around easing accessibility with more options like telemedicine, for example, giving online scheduling, capabilities, making it very easy for them to access care. That's a huge determinant of the patient experience. And then the other key component is the quality of communication, right? So how much empathy do I perceive from my caregiver or any stakeholder in the system that I speak to? And how do I feel like they've really listened to me, that they know me, right? And that really comes from empowering the stakeholders that interact with the patient, arming them with all the right information, taken from a combined data system that the both of you talked about a little bit. And then also giving them tools so that they don't have to spend their time typing notes or looking for data, right? They can just focus on who they're talking to and have that human connection. So I think these are really the 2 major trends if I were to distill. And that's where we have to kind of meet the patients where they want to be met.
Thank you so much, Neela. Totally relatable. We digital consumers want everything and anything with the convenience that we have gotten used to. And as Akhtar and Dr. Waleed said, all of these important dimensions of policy, processes, and technology are coming together to sort of deliver those expectations to patient. And this brings me to the next question, which is we have seen generative AI in 2023, right? It surprised, challenged, inspired all of us. And a lot of us have seen those operational efficiency use cases coming out of generative AI. And I want the panel to discuss what could be the next wave or next horizon in both long-term, short-term, and mid-term could look like. So I would bring in Akhtar. Like, Akhtar, what is the mid-term and long-term looks like, especially with the advent of generative AI now?
Sure. Thanks, Pankaj. I think it has a broader role to play. And one thing I want to also highlight, I was in a class conference for Middle East couple of weeks before and just writing on the previous conversation. I was really surprised that 72% organization in Middle East had a goal of patient experience for the next 5 years. That totally defines, like, we might not be focusing on the value-based care, but we are still taking as a Middle East, every organization is focused on improving patient experience, and they have taken some level of initiative to kind of improve the patient experience. In terms of the impact, it can be divided into larger roadmap where we have a short-term impact, where we have a mid-term impact, and where we have a long-term impact, how technology is going to revolutionize it. And what Neela mentioned, the biggest factor in terms of patient experience right now is the burden that physicians and other care providers have, their overutilization. Even if we talk about like the recent episodes in the UK when the number of nurses went on strike, and we see that everywhere in news that, hey, we're a short of 20% physicians, 30% nurses and whatnot. And that's because of the burnout. And in that case, I think technology and specifically AI is going to play the most important role. The first thing that is going to get revolutionized is optimization of that, making sure that that administrative burn is reduced. The workflows are automized in terms of, let's say, hey, if a caregiver or a physician is having a conversation with a patient, that gets automatically recorded without them having to use the keyboard for next 10 minutes in terms of documenting that. So optimization of that administrative work is the first thing that I see is going to revolutionize because of technology and AI. In terms of the midterm effect, I think it's going to move more towards proactive care, because right now the way healthcare is perceived, it's very reactive. Patients feel sick, a particular condition occurs, and then we kind of start rushing towards the clinic. That's human nature. That's like each of us does that. I think it will get very proactive in the nature where we will be able to determine to some extent the occurrence of a particular event, and a number of factors are going to contribute towards it, specifically from the clinical decision support point. Hey, based on the data of a particular patient, if a series of events have occurred in the past, what's the probability of a critical event occurring down the line? And can we take certain corrective actions around that? So it's more towards that healthcare will move from reactive to a very proactive nature. And with the evolution of smart wearable devices, that is just going to augment this revolution where we'll have more or less the real-time data of the patients, and we will be able to draw much more conclusive actions. Similarly, use of precision medication is going to get like in a very advanced system going forward, where it will be used on more like on day-to-day basis to help patients, and not only in like one-off scenarios, I will say. So that is the midterm impact I'm seeing. In terms of long-term impact, I think how we predict and improve the life of patients and increase the longevity of the life cycle, that's going to be the first factor in terms of long-term effect. But I would love to hear from Dr. Waleed on that, because he has kind of led those initiatives in the Middle East, basically like, hey, how can we determine the impact? Like his close association with NEOM in terms of the digital twin and other initiatives. Dr. Waleed, for the long term, I would love to hear what the impact is going to be.
Sure. Thank you, Dr. Akhtar. And I think you have nailed it with dividing it into short and long terms. If we are to, as you said, talk about how are we going to tackle each one of them. When we're talking about optimization, this journey, as you correctly said, have started a long time ago. And it maybe is going to reach maturity soon with the addition of the new platforms, not necessarily AI powered, but data driven, I would say, because the AI could be a component. This is still, a controversial subject, but solutions, because our traditional healthcare system was always based on a direct interaction between a patient and a doctor through, a vocal or a paper format. That's the evolution of medicine throughout the history. And then we look at the past 25 years where the healthcare system had been optimized, I wouldn't say developed, through the addition of the data-driven solutions that can sit on either on top of old systems or new system, integrate with it, and just act as an optimizer to whatever we already have, either EHRs or other solutions. And this is already implemented in the region on a wide scale, I'll have to say. There are still a lot of room for improvement, but optimizing what is already existing in the region through the addition of data-driven optimized platforms takes the healthcare system that we have now, as Dr. Akhtar said, from being a healthcare catering for the sick to more robust that can actually add more, which brings us to the other or the next phase, which is the med phase, which is how can we transform the already existing and again data-driven healthcare systems from being reactive to people who are being sick to being proactive and predictive and preventive. All these hyperts are coming that are reshaping the, I would say, healthcare 2.0 that is being, implemented now. We don't want the healthcare systems to be a place where people go when they are only sick. We want the healthcare system to actually act as a preventive of certain diseases, and that can happen through, again, the transformation of the traditional healthcare systems, HR and data collection, to being more robust about looking at the data from a preventive aspect, seeing how can we actually improve the journey, but by adding a component of healthy people journey and not only patient experience that is only active when someone gets disease, and Dr. Akhtar said. The long term, which maybe NEOM would be a good example, and most of the GCC countries, is how can we innovate? How can we go beyond the Health 2.0 when it's data-driven solutions? How can we innovate the healthcare systems to even try to predict the person journey through additions of something like a digital twin, for example, where we can collect data from different people, simulate them in a closed environment, and look at the journey before it actually happens. We're predicting the journey here. This is still under development. It's still not implemented anywhere, but I reckon that this is going to be the healthcare 3.0, which is just how can we build a healthcare system where the outcomes are to prevent diseases and not to treat them all. Again, healthcare will be around treating diseases, but preventing them is a notion that have been there for 100 years. It started with development of vaccines, for example. That's the basic of how can we prevent diseases. But now we want to go beyond the traditional, drug-based prevention, which is now we're talking about data-based prevention. It's development of platforms that collect data, analyze them, look at them and try to predict and prevent the occurrence of certain diseases. And this is the future. And again, a lot of these initiatives have been is being implemented in the region, in Saudi and in UAE. We have also evolution of the longevity initiative of Saudi, which is again catering for improving the quality of life and increasing the longevity of people through having them living a better, healthier life. There is a lot of initiatives that feeds into that long-term vision, as Dr. Akhtar said, but all of them, the main driver for all of them, they are data platform driven. This is the main key component. The next evolution in healthcare is a data-driven evolution.
Thank you so much, Dr. Waleed, and such an exciting vision of the future to come, right? And the first problem the doctor was mentioning, the physician burnout, the pressing challenge, and I still remember the campaign that was so relatable and was inspired a lot of us, that had the title that these hands are not for typing. So good to see that we are already sort of solving that physician burnout problem in the short term, and midterm would be about putting the patient at the center of the healthcare, making it proactive, participatory, and ultimately going to a future where we can simulate the scenarios using advanced technologies like digital twin, metaverse, and predict what could happen in someone's life in next 5 and 10 years. And Dr. Waleed spoke about NEOM that is already on this path. Neela, any favorite use case from your side that you have seen getting discussed a lot in your circles?
Yeah, no, for sure. I think these definitely cover a lot of them: preventive care, digital twins, precision medicine, metaverse, right? I would say maybe it's not a new concept, but this idea of show me, you know me, right? So patients want their health systems to show them that we do know you. And we're able to actually make helpful suggestions because we know you. We're not going to bother you with untargeted campaigns that are not relevant to you, right? When you call us, we already know most of the things we need to know, and we can just get to it immediately. I think especially in the US context, there is a lot of frustration around, having to kind of give the same information over and over again. There is this sense of fragmentation of not just information, but just really the whole healthcare experience. And so just bringing it together in a seamless way, and taking action based on very personalized insights that you might have about someone, right? I think that's a notion that's gaining a lot of ground.
Thank you so much, Sheila. And I'll just give a brief summary of what we have discussed so far, because I know a few of our audience have joined late. So we have discussed the important aspects of patient experience, which is accessibility, affordability, education, and engagement. We heard some of the top initiatives and stories around patient experience from 2023, basically how policies, processes, and technology are coming together to shape the future of patient experience. And then we discussed the roadmap or vision of the healthcare of tomorrow, inspired and powered by generative AI, which is going to be starting from efficiency-based scenarios, efficiency-based solution in the short term, leading all the way to innovative, data-driven decision-making and predictions in the long term. And before we jump on to the next section, I have a question that has sort of been DM'd to me by 5-6 audience. And Akhtar, I would want your feedback or your response on that. Folks are asking that, is the path to the future of healthcare for Middle East is going to be what US or UK have taken, or is there going to be a lot of nuances in that path? Does Middle East would want to create that path for themselves?
I don't think they need to follow exactly the same path. I would rather say Middle East in the right direction in terms of the way they are envisioning patient experience. Rather than exactly following the same path that US took, we need to take learnings from US and Europe and embed them in the current, I will say, roadmap. If I broadly compare the roadmap, what we saw with Obama bill coming into the picture, and then interoperability and then patient experience, like I'm talking about 10 years back, around 12, 13, how kind of US envisioned it. Middle East is kind of almost following 70% of it, but the biggest factor will be we don't repeat the mistakes that US and Europe did, because every country has its own secret sauce. I use this terminology everywhere that, hey, it's a secret sauce, like off-the-shelf healthcare solution never work from one region to another. If a policy has been adopted in US, that was kind of drafted with a different set of dynamics considering how healthcare was provided. As in simple example, I will say US is a very primary care oriented market where the first consultation, the first point of contact is always going to be your primary care physician. While as in Middle East, we follow a totally different approach. We have less of primary care centers and we have more of, I will say, hospital outpatient departments. We should definitely follow or track the good things from the US. The end goal still remains the same, that, hey, how can we improve patient experience? But the most important thing will be like, hey, how can we take learnings from the US and not repeat the mistakes that they did? Like interoperability was a big miss in the US, as far as at least what I feel personally. A couple of panelists might disagree with me on this as well, that they didn't thought through interoperability upfront, how multiple systems are going to communicate. We should not repeat that problem over here. We should kind of focus on that upfront and then kind of like lay the landscape for patient experience.
Thanks, Akhtar. And I still remember when I started out in Middle East 3, 4 years back, someone told me that we already know the mistakes that should not be made by seeing US and UK. So, and looks like a very good topic for our next session or next webinar. But moving on, so it's like, given now that the future of healthcare is going to look very different, but a lot of the folks that we speak with, they want to know what are the enablers that they should have in place so that they can get benefits, right? They can also sort of take advantage of these new technologies, new use cases. So I would want to start with Akhtar, you.
Sure. To kind of talk about it, I want to kind of repeat two important things that Dr. Waleed and Neela mentioned in the previous conversation. Dr. Waleed mentioned that, hey, healthcare is going to be data driven and it's going to be healthcare 3.0. In my language, I used to call it healthcare 2.0, but the goal is same. Healthcare is going to be data driven, totally agreed. And second, that Neela also mentioned that, hey, we don't want to send the same repetitive information to patients again and again, because when somebody is sick, it kind of frustrates them more. I want to focus on those 2 points, like, hey, what the approach is going to be. The first approach has to be that, hey, you need to have a very robust data management platform, because the journey is going to be driven by data going forward. And when we talk about patient experience, the number of personas involved in this, the number of stakeholders are very high. There is physician who is kind of documenting the clinical findings of the patient. There are care managers or health coaches who are talking to these patients on a regular basis. There are pharmacists who are kind of doing the medication reconciliation. There are labs where all the orders are getting processed and whatnot. And having the right data from all these sources is going to enable a better patient experience. So having a very robust healthcare data platform that allows interoperability, that allows ease of integration, is the first must have, because that is kind of the landing pad or the cornerstone of when we talk about patient experience. The second one, more alluding towards what Neela was mentioning, having a CRM system that is very efficient, that doesn't give the same repetitive information to the patients. It understands that, hey, what is the right fit for a patient? I don't want to send a generic educational sock to a patient who is kind of suffering from diabetes or congestive heart disease. Like, we have to kind of do that segmentation. The platform has to be smart enough to understand that, hey, what the patient behavior is, how can we kind of enable decision tree support over there and make sure the right information is going to the right patient. And then on top of, once these two layers are established, we have a robust data-driven journey which enables patient experience. We have an amazing CRM system that makes the overall process efficient, that makes ease of access to patient much better. Then AI and other sources of technology like the generative AI is going to be the next layer, which will help us to optimize all of that. But even before, I will say, like, we jump to AI, we have to focus on building a robust data platform, which is cornerstone of this. And on parallel to that, or on top of that data robust platform, we need to have a very smart and an efficient CRM solution. Those are the two important factors for an, I will say, sustainable patient experience.
Thank you, Akhtar. And Dr. Walid, again, would want to leverage your extensive experience to understand from your vantage point, what are those enablers that should be in place to get benefit out of AI revolution?
Again, I'm Dr. Akhtar and the rest of the team are more suited to talk about this, but I'm gonna complement this by talking from my point of view, which is not a technical point of view. It's more of the end user from a healthcare perspective. I think we need to ensure that certain measures are taken when we're talking about these platforms to ensure that these platforms are going to be here to stay. Integration is the first word, and again, from a technical point of view, as Dr. Akhtar said before, well, it's really hard to bring platforms from that are developed somewhere else and try to integrate them in our systems. The systems differ between countries, and people don't take notice of that. Cerner, which is implemented in the States, and Cerner, which is implemented in UAE, are technically the same platform, but the data that is fed is different. It's fed by people who live here. And this is where secondary platforms that ensures this seamless integration between the data and the EHRs are crucial to ensuring that we are on the right path into having this data-driven patient experience and data-driven healthcare systems. A second thing would be when we're talking about integration, we're talking also about data that should be collected outside of an EHR. An EHR collects data that are collected within a healthcare facility or a healthcare system. But now with all these new improvements and the addition of wearables and collection of environmental data, all these data are very important to be integrated within the EHR. Unfortunately, EHRs are not designed to do that. And this is where platforms are needed to actually integrate between purely clinical data and supporting clinical data. They are still clinical data. If I know that someone lives in a certain environment, while these data are not purely clinical, they are not generated from a hospital, but they do contribute to someone's health and someone's journey to a certain pathway to a certain disease. And these platforms are crucial in collecting these data because they are more robust and they are well fitted to collect these data and then integrate them with already existing EHRs. When we are talking about a data-heavy driven platforms and patient experience, then we have to address a very important point, which is the security of the data. Security is becoming a crucial point now. In the old days, it was files that are secure in a certain room. Now we have data that are sitting in either servers or in the cloud. And a very important point that is being discussed, and it actually, and maybe in this region, it's apparent more than the other regions and the states and the Western world, is we don't know how to address security without preventing the evolution of healthcare. Always, and I'll take this from a personal experience. The biggest hurdle in integrating platforms with EHRs in this region will always be the security. People are worried that if you put something on top of something, and that should not be the case. Security should be security as a whole of the system and not security of adding something on top of something else. Platforms and EHRs are being crucial now, and I think we should not forget that security is very important, but at the same time, we should not take it as a barrier to implementing innovative solutions when it comes to improving healthcare and adding more data points. A third point that can add to this security concerns is education. Education now, people are used to a certain way of conducting the healthcare and the healthcare systems, and without educating people about the importance of data-driven platforms and data-driven healthcare, these advancements will always be hurdled by the lack of awareness about the importance of adding such modalities into our healthcare. And as I'll end by addressing the last point of what Dr. Akhtar said, which is sustainability. All these three elements added to whatever Dr. Akhtar said, it feeds into a big pool of how can we sustain the momentum that we have now of shifting our healthcare from a conventional healthcare to being a more digital and then a more data-driven healthcare. We have to address the sustainability issue of how can we take this forward without going backwards again because of certain points. I think these are some of the measures that we need to address when we're talking about how can we move forward with a data-driven patient experience and data-driven health platforms.
Thank you so much, Dr. Waleed. So I think we also keep hearing this whenever we speak with different stakeholders that the key enablers are we need to have a trusted, scalable, interoperable data platform. And as you said, it has to be secure by design. So security doesn't become an impediment in our path to innovation. We need to have a CRM that can reach out to patients where patient wants to be reached out, can enable multi-channel communication, can enable education. And last enabler that we discussed was AI. We need to have generative AI that is accurate so that we can trust the insights, we can trust the information coming out of it. It has to be secure so that organizations know that their data is not training someone else's data models, and it has to be compliant so that each region is sort of trusting the AI as per their mandates. So now, Neela, I know you are at the forefront of creating those solutions that are sort of bringing the healthcare of tomorrow, right? So I would want to know companies like Innovaccer who are building that tomorrow, what you guys are doing to transform the patient experience.
Absolutely. Our approach is always to remain focused on what outcomes are we trying to drive, right? So more productivity, better experience, more efficiency, better care, right? We don't want to go with this positioning of, oh, now we must use AI, because that's not the problem we're trying to solve, right? So when we anchor on improving these outcomes for patient experience, that's when we start to think about how can we leverage AI most effectively, right, to get to those goals. And at Innovaccer, for example, we have personified our AI engine with the name of Sarah. But the whole way we're thinking of Sarah is that, it's not an AI tool, but it is something that we're infusing into every offering that we have so that we can improve the experience of both the user and the patient with whom the user is very likely interacting, right? So we want to use Sarah, for example, to transcribe notes when the physician's speaking so that the physician can focus on the patient, or perhaps to automatically generate documents while a call center agent is speaking with the patient, or to help assist in a smart way to find answers to questions that the patient is asking, or to create, custom care plans. Those are all the ways in which we are using the power of AI, right? So Sarah is being used in all of these different ways to ultimately drive greater productivity and greater, freeing up of the time that these stakeholders need to spend with the patient, right? So that's kind of the overarching way in which we think about it. And the other thing I also want to say is that any AI for healthcare, I think the biggest thing that it needs to be able to do is to understand healthcare, right? So we need to teach it medical concepts. We need to make sure that it understands, medical jargon. It understands enough to be able to kind of derive meaningful summaries out of that. So that's an area in which we're, of course, spending a lot of time. But yeah, just really staying focused on taking away all of the manual tasks and taking away endless search to give back time to focus on the experience, right? That's the positioning. And then something else I also thought would be interesting to touch on, although it's not directly related to AI, is that, Innovaccer is so committed to going even deeper into the patient experience. We have recently acquired Cured, which is a leader in the digital marketing and CRM space for healthcare. And this is a really significant milestone because, with this, we will add over 20 health systems and clients to our current portfolio of over 95 customers. And we are going to be even more in a position to deliver even more personalized and market-leading healthcare experiences with their expertise in patient and member outreach, engagement, growth strategy, some of the things that we were talking about, right? Being very, very personalized. So yeah, not only do we want to improve the patient experience, but also outcomes. And with this kind of approach to AI and with our acquisitions in this space, we're very, very committed to doing that.
Thank you so much, Neela. And I think we are almost at the top of the hour. So my takeaway from this discussion is digital consumer expectation is changing. So patient experience expectations are gonna be ever evolving concept. We have seen last year that policies, technologies, and processes are coming together to deliver on those expectations. We see the future of healthcare is gonna be very different from what we see today. It's gonna move from efficiencies powered by AI to all the way innovation. And as Dr. Waleed and Akhtar has mentioned, that to enable those capabilities, one would need to have a good data platform, a good CRM engine, and reliable AI. And innovative companies like Innovaccer are already offering intelligent healthcare experience through their platform and Sara suite of solutions. So let me see. I think there are a few questions. Let us go through that, and we can then, I think we can take one question. I see one hand raised. Give me 1 second. But let me just take a pause and see, Akhtar, Neela, any takeaways from your side that we want to highlight before we go to Q&A?
No, I think based on the inputs from Dr. Waleed and Neela, we have pretty much covered it all. It's more towards like kind of adhering to the roadmap and kind of learning from the mistakes that will again repeat.
Perfect. Cool. I think if we will reach out to the participants and audiences. I know there are a few questions that you would need to answer to. One question that we can take is how can we leverage data analytics to create personalized care plans for patients, right? I don't know, Neela, if you want to take this up, or Akhtar, do you want to start first? But basically, folks are asking how to leverage data analytics to create personalized patient experience?
I can start, maybe Akhtar, you can add to that. The step one to leveraging data and analytics is really to determine, create very, very intelligent cohorts, right? So the more you can segment groups into different, psychographic profiles or different persona groups, the better you'll be able to tailor all kinds of messaging to them, right? And this is like not, I mean, of course, this is a concept that has existed for a while in the marketing space, but I think within healthcare, we tend to put less focus on that because, of course, we're not thinking in terms of marketing like other industries. But even in the realm of care, I mean, it's just so important to make sure that we are segmenting groups in the right way so that we're actually catering to things that they need. So that's like kind of step one. And then step two is also to think about, now that we know who they are and what kind of messages we may want to send to them, right? Being able to really create those journeys by triggering, if then sort of statements based on where they come into the care system, right? Making those decisions and being able to trigger actions, being able to kind of create this intelligent brain to guide someone through the patient journey. I think that can only be enabled by really, really strong access to data that you can ping and query, right? So that's another kind of major way in which I think data and analytics is transforming patient care, because we can actually craft these end-to-end journeys. And then finally, getting those insights and passing it back to the stakeholders that are making decisions on patient experience and any other aspect on care, right? That's another very big need. How can we, you can't improve what you can't measure, right? So some of the patient experience measurement tools combined with, deep data that we have about them help us to really kind of measure where we are and improve continuously.
Thanks, Ila. Akhtar, do you want to add more color to this?
I think Dila covered most of it in terms of stratification of the patient. That is the most important aspect. And I think the only additional item I will say, like, understand the risk of the patient, basically, because high risk patients, like where the vulnerability is very high, that need to be kind of given utmost focus. That's a part of the stratification, but understanding that clinical risk of the patient, that is going to be very critical in this.
Thank you so much, Akhtar. I think we are at the top of the hour, so we will want to wrap up now. I know there are a few questions that we could not take up, so we will make it a point to reach out to you guys with the correct material and answers. And if you have any questions that you were not able to type in, you can just mail it to team.me@innovaccer.com, and we would look forward to hear from you. So thank you so much, and have a great day, everyone.
Thank you.
Everyone.
Thanks, everyone.